Perfect. I have mom and baby with me, and we're going to be doing a newborn assessment. This is Lucy's perfect newborn baby. And so first we're going to do is we're going to dry baby off with a towel, rag, and she wants to know how much baby weighs. So we're going to do it in like ounces, and we're going to do it in grams. And we're also, while we're here, we can measure baby. I don't have a tape measure, but we could mark off, or we could do from here, here, here. And that would be in centimeters and inches for mom. We're gonna do heart rate, and it'll be elevated over 100, most likely. We're gonna do respiratory rate, which could be well above 16, even in the 30s. And we're gonna do axillary temperature and rectal temperature once, because we don't want to damage any tissues. Okay, mom doesn't care about this. And then we're gonna make sure that we get the apical pulse, so I can get out my stethoscope. Oh, and we can assess pain. You know, the baby will be crying. We're gonna make sure baby's not in distress or is a pain cry. And while the baby's crying, we can see skin color is probably red. So while I have my stethoscope out, I'm going to listen to heart sounds and apical pulse and 5 points. Lung sounds, they could be wet, and their bowel sounds. And we're going to listen for a full 60 seconds because babies' heart rates are irregular. 60 seconds. Listen to those bowel sounds. I hear slightly wet sounds, but we're gonna make sure that it's not, we don't hear any like wheezing or grunting while they're breathing. And I'm gonna go ahead and look at the back, listen to the back, and I can assess a lot of things from behind. I can see that lineage, the hair. I can look for mongolian spots, look at their buttocks, make sure there's no spina bifida. I can see they have a C-shaped spine. Okay, I believe I'm done with my stethoscope. And again, I'm gonna assess more on the skin. Make sure that there's no jaundice. That's pathological. Physiological jaundice would be acceptable because their liver isn't able to filter all that bilirubin properly, so it would go yellow from cephalic to, forgot the word for feet, but feet, and then feet back up, red. And a newborn, that's full term. The skin turgor is more difficult to assess. Their skin would be smooth. The vernix would be normal. It would probably be in the folds, but we don't want to wipe that away, and they would have villi on their nose, and we don't want to pop those. And we want to make sure there's no rashes or anything. And I'm going to check circumferences as well, since I already measured them and I have the tape measure out. Circumference, head, chest, and abdomen, and in Pooh Bear it's fairly large. And then I'm going to continue head to toe after I do my reflexes. So the startle reflex, splay out, rooting reflex, they should follow my finger, and I'm going to see their sucking reflex, and while I'm here, I'm going to assess their tongue and their hard palate and soft palate. Since mom is right here, see if how the baby's hearing is doing, because it should be able to recognize the mother's voice. I'm kind of going all over the place, but I'm looking at baby's ear to make sure that it's in line, while they're sucking. And I could play with the ear, make sure they're recoiling. It's recoiling, there's no flabs, folds, anything out of the ordinary that could tell me there's something else wrong centrally. And then I'm going to assess the palmar and plantar grasp. They should be grasping the babiski, the prone crawl, and I'm going to assess the curvature, palmaris trunk curvature, and I always forget about this one, fencer. So if I put their face this way, face that way, like a fencer. Okay, now I'm going to go head to toe. I'm going to make sure that the head, there's no cephalotomas, there's no, it's on the suture line, the crepitus. Those would be easier to filter out versus the other blood blister, the cephalohematoma. No molding, the fontanelles are flat, that's good. Check baby's face again, the milli. I've already checked their eye. I'm going to check their eyes for blinking reflex. And when I do this, I can assess other things like their conjunctiva, make sure it's pink. I can do pearl, not perla, pearl, make sure their pupils are equal and reactive to light. Whenever baby's breastfeeding or with mom, I can see eye contact. And I can assess mom in that moment as well. So I did eyes, nose, make sure they can breathe out of each nair. We assess the mouth, make sure everything's symmetrical. And then, let's make sure I'm on track. And the next really is apparently really strong. I'm not gonna grab baby inappropriately though. In this moment I can check clavicle. It could be compromised when going down the vaginal canal. And also when doing the startle reflex, assess if the baby's hands are symmetrical. If they're asymmetrical, it could tell me that something's wrong with the clavicle. Check for any redness, check for any bumps. There might be vernix around the folds of the neck, that's normal. I already checked the abdomen, but I can check the umbilicus, the femoral and inguinal pulses, feel those. I can feel for any hernias or anything abnormal there. Heart, checked heart. And at this point, I can check the baby's chest though. A full-grown baby, full-term baby will have breasts that you can actually measure, feel, hands and feet. The feet will be blue because the heart's sending blood to more of the major organs. And again, the more full-term newborn, there'll be folds versus preterm smoother. So all of these assessments can help you tell how long baby was in the gestation period. And then I can check hips. I'm losing my words for like anatomical cues, but right here and then up and out, and you could hear the clicking and you could feel the displacement. Spine, I already assessed the C-spine. And then we already assessed the buttocks. And I guess right here, genitalia, female genitalia, and a more full-term baby, you'll have a bigger labia versus a clitoris. Just want to make sure that everything that's a girl looks like a girl, because baby could be intersex or something like that. And so for a male as well, you want to make sure that their scrotum is there and has the folds of rugae, and that the urethra is central on the penis and not top on the bottom, anything abnormal like that. And while we have baby up, we can check the anus, And after baby feeds, we can assess bowel sound. We can assess the bowel movements and urine. They should be using bathroom pretty frequently. Clear urine, should be changing diapers 6 to 10 times. Well, they're voiding 6 to 10 times, and the Meconin is that black tarry stool. Then once baby starts breastfeeding, we're gonna get more of the liquid yellow, sweet smelling versus when they're formula fed. It's gonna be darker. We just wanna make sure that there's no bloody stool, that they are passing, that they do have bowel movements and they're peeing. And, I already said the baby's crying and what kind of cry that is. I'm just gonna make sure that I got everything here. Did vitals, skin, chest, let's go, ears, eyes, extremities, chest. All right, this is a healthy baby. Good job, Lucy.